Hello friends, I am Dr. Teena Bannihatti. Today, let us understand about the cervical cancer and how is it caused and how we can prevent this. So before going ahead and understanding about the cervical cancer, let us understand what is the meaning of cervix. So this is the uterus where the baby grows, and the lower part of the uterus, we call this as the cervix. So what is cancer? Any uncontrolled growth of cells in our body, we call that as cancer. Hence, any uncontrolled growth of cells from the cervix, we call that as cervical cancer. So India alone contributes almost quarter of the cases of cervical cancer throughout the world. In fact, every one lady in 8 minutes is dying because of cervical cancer in India. What are the factors which lead to the onset of this cervical cancer? Number one, early onset of the sexual activity, almost in the teenage, like 15, 16 years, like that, or maybe earlier. So the second one is the human papillomavirus infection or the HPV infection. So the third one is smoking, and the fourth one is anybody has got the weak immune system. So all these are the factors which leads to the cervical cancer. HPV virus or the human papilloma virus can be transmitted through sexual activity or through skin to skin contact. There are few strains of HPV virus which belongs to high risk category like HPV 16, 18, 31 and 33. Whenever these HPV virus goes and infects the cervical cells, so it's going to make changes in the cellular DNA. Few infections may resolve in like 6 months to 1 year depending upon the immune system of the patient. Suppose if the infection is not resolved and there is a long standing infection over 5 to 10 years like that, then these persistent DNA changes in the cervical cells may lead to the onset of the lesions or the conditions on the cervix, which we call it as precancerous lesions. So, if we do not detect and treat at that stage, whenever precancerous lesions stay over a long time, like 2 to 3 years or over 5 years, again depending upon the immune system of the person, that may get converted into the cervical cancer. Now, let us understanding the screening modalities for cervical cancer. So, as the cervical cancer is caused because of prolonged infection of the HPV virus, we do get good amount of time window to screen these individuals. So, there are two modalities to screen for this. Number one, pap smear. The other one is HPV DNA detection. So, let us understand how is pap smear done. So for the pap smear, the lady has to visit her gynecologist. So she'll be lying on her back and using the medical instruments will be opening her vagina to look at the cervix. And using a small plastic broom, we will be taking few cells from her cervix, which will be put in the liquid. And that liquid bottle will go for the microscopic examination. So in the microscopic examination, we are going to check, are there any cancer-like cells or not? And accordingly the report will be issued and she'll be managed. So with the same sample we can even perform the HPV DNA detection as well. Now let us understand how frequently are these pap smears advised. So pap smears are advised once in every 3 years from the age of 21 years to 65 years. So if any lady is not married or not sexually active at 21, 22 years, absolutely it's not indicated. So once the girl becomes sexually active, she can start following these pap smear schedules. And if anybody is clubbing the pap smear along with the HPV viral DNA detection test also, then this can be done once in every 5 years. So many ladies ask me, Doctor, I'm all healthy. Why I have to get this test done? Is really pap smear required? The answer is yes. See, the screening tests are done for healthy individuals. So many a times whenever there is a precancerous lesions or chronic infection, there may be no symptoms at all. Hence, it's absolutely required that you have to get your pap smears done. Now, let us see, can we prevent the cervical cancer? Because cervical cancer is caused in majority of the cases because of HPV viral infection, we have to prevent this infection. So can we prevent HPV viral infection? Yes. we have got vaccine to prevent this HPV viral infection. So there are many brands which are available in the market. Few of them are like Gardasil, Gardasil 9 or Sarvavac. So these are going to prevent the HPV viral infection. So how frequently and how many doses are advised? Total 3 doses of vaccine are advised. So the first dose, if we give today, the second dose will be 2 months after today, and the third dose will be 6 months from today. And who all can take it? What is the age bar? So anywhere from 9 to 26 years, the vaccine can be administered. Of course, if many people say, no doctor, I missed, I did not take my vaccine, then up to 45 years of age you can go ahead and take the vaccine. Even though you have received the vaccine, still it is very important to follow the pap smear schedule. And apart from that, how we can prevent the cervical cancer is follow the safe sex, especially those who have multiple sexual partner. Make sure you use the condoms. So the other important factor is quit smoking, because smoking causes cancer almost anywhere in your body. Hence, quit smoking. Last but not the least, staying fit and healthy is very important. This is achieved by the regular exercises and by the intake of the balanced diet. Hence, stay fit, healthy, and check yourself by the pap smear. And if anybody has not taken the HPV viral vaccine, so please take the vaccine and protect yourself from the cervical cancer. Thank you.